Hello, everybody. Welcome to the Docker Frontier webinar on anticipating impacts of COVID-19 on LATAM healthcare systems. We're just waiting for a few more colleagues to join us, and we'll be getting started in about 2 minutes or so. Hello, everybody, and good morning, and welcome to our Docker Frontier webinar on anticipating the impact of COVID-19 on LATAM healthcare systems. My name is Martina Balzajeva, and I'm head of research at Docker Frontier. And we're joining you here with a few of my colleagues from Washington, D.C., as well as from London. Before we get started, I realized that some of you may be new to Docker Frontier, so I thought I would take 2 minutes to provide you with a very quick overview of our firm and how we work with executives at major multinationals. For those of you who are just joining us, if you are not able to see the materials today, I encourage you to log into GoToMeeting to view the materials, as we'll be sharing some very interesting presentation materials for you all today. And then if you would like to ask a question, certainly feel free to do so. You can do that throughout, and we will do our best to answer as many of them as we can. You can submit a question by clicking on the Q&A box of the GoToMeeting application. On the right-hand side of your screen, you should be able to see that. And if you type it to Docker Frontier webinars, we'll gather questions and do our best to answer some of them. So as an introduction to Docker Frontier, we are a market intelligence and consulting firm that provides tailored solutions to drive growth for clients across the B2B, healthcare, very relevant, of course, to our conversation today, as well as consumer and technology sectors. Our dedicated teams serve as advisors to senior executives, delivering the market and industry knowledge they need to succeed at all points in the business cycle. We provide clients with continuous research and insights, custom solutions and transaction support services, as well as timely, actionable insights to adapt and win in changing markets. And of course, we are facing our own set of very, very rapidly changing markets right now. We are headquartered in Washington, D.C., and we also have offices in Troy, Michigan, New York, London, Paris, Berlin, Singapore, Shanghai, and Bangalore. If you would like more information about our business, please visit our website at dockerfrontier.com. With that, and with a very brief overview, I would also like to introduce you to our presenter and really the star of the show today. I'm Alec Lee, who is Director of Healthcare Research, and he will be taking us through most of the conversation today. And to give you a sense of the agenda that we will be covering during today's conversation, we will start by looking at the macro environment across Latin America. And we will then go a little bit deeper into the COVID-19 impact on market access and reimbursement across the LATAM region. And we will wrap up with a conversation around the impact of COVID-19 on external stakeholder engagement across the region as well. And the types of questions that we will seek to answer for you all, or at least provide you with a point of view during the conversation today, include questions around how the healthcare and economic fall of COVID-19 would impact financing in healthcare, what kind of financing we expect to see prioritized, whether it's more coming from the public or the private side, whether we are expecting to see any changes in the way that cost reduction measures are implemented across the region, especially in markets that have already been using some of these tools. Whether PPPs will become something that governments are more open to, and similarly, whether we will see greater adoption of digital health initiatives. So a lot of very interesting questions for us to explore today, and I also imagine that you all have your own points of view. So certainly feel free to message us using the chat function, and throughout. But at this point, I will pass it over to Alec, who will walk us through the first section of the conversation, starting with the macro, the foundation of all of the additional analysis we'll be doing, and looking at how that links into the outlook for healthcare systems across LATAM.
Excellent. Thank you, Martina. And good morning, everyone on the line. So as was mentioned here, what we're going to do is start out by looking at the macroeconomic situation in the region to contextualize then how each government is going to be able to finance both its public and private healthcare systems and the impacts to the providers and the impacts, therefore, to your business within the region. Now, when we first look at the macroeconomic situation, obviously, this is a very complex an evolving moment to be forecasting macroeconomic indicators across the globe, but particularly in Latin America, which is one of the last regions to be hit by the pandemic. So I'd like to begin with the framework that we're using to conduct this analysis. Our key inputs for understanding how each market in the region will react, economically speaking, include our expectations for the recurrence, length, and stringency of social distancing measures, the potential for government stimulus during and after these social distancing measures, so effectively how much fiscal space does each government have, and then finally the timing of a potential treatment or vaccine on a global level, obviously, which would potentially negate some of these, well, the first two questions that we have here in the case of a vaccine, given the fact that you had significant access. So as normal, and as most of you expect from us, we are working with different scenarios when it comes to answering these questions. And the scenarios are based around a paper that looks at this situation from the perspective of how quickly countries are able to go into quarantine and therefore smash the curve of infections, and then how they're able to exit from quarantine. So our base case for most governments in the region is that they're going to be able to exit from quarantine and maintain some social distancing measures in order to avoid a full-blown second wave of infections. Our downside scenarios are around or specifically focus on what would happen if you had a large second wave of infections. In our upside scenario, which unfortunately for very limited cases in Latin America is going to be very hard to see, one of those particularly would be the case of Costa Rica, where we already see significant containment, would be essentially the elimination of all major clusters and a strong fiscal stimulus. Now, even in our base case, we have questions about how well governments will be able to maintain what this dance coming out of containment. So will the dance be one of that's more, let's say, you have more time between new infections, or will it be shorter and choppier and looking at less effective measures in the short term to maintain new outbreaks? Now, to answer the question between where each market is going to go, we've been analyzing the markets throughout Latin America, your major markets, looking at 4 effective factors. So first of all, how quickly did each market react to the situation? We all know that, for instance, Argentina, Colombia, Panama, Costa Rica, as well as Chile, were all very quick to the game, and they quickly shut down borders, as well as Peru. But then there are others, such as Mexico and Brazil, which are more federalized systems that were slower to react and really weren't able to get this under control as quickly. The second is what information will be available for policymakers to help test and trace infections. So what's the testing capacity within laboratories, but also the ability for governments to supply those laboratories with actual testing capacity. Third, what is the treatment capacity? So effectively, when there are new outbreaks of infections, do you have the ICU capacity to isolate these individuals? Have you been able to redesign hospitals to separate infected patients from those that are not infected or undergoing other treatments. And then finally, what's the endorsement from local authorities? And I think the obviously most important example here is the discrepancies between what the presidents in Brazil and Mexico are saying against local authorities, and the impact that that's had on willingness of the populations to actually adhere to social distancing measures. Now, when we look at these scenarios, we've plotted your different markets in Latin America across both their ability to undertake this dance, so exit from quarantine, and then maintain that exit without undergoing significant new rounds of infection, and then their ability to pursue both fiscal and monetary stimulus. And what we see is we have a lot of divergence across the region. So effectively moving from those less effective at the dance, Mexico, Brazil, to those more effective, Chile, Colombia, Argentina, Peru, and those with more potential fiscal space. So the ones with more potential fiscal space obviously are Chile and Peru in the first instance, but potentially Brazil, should it decide to continue to relax some of the fiscal constraints it put on itself in the last several years as it was undertaking a pension reform. Now, overall, what we've seen, and I think that this is some good news, is that due to the fact that the Americas specifically was the third region to see this pandemic coming and had some time to react. I already mentioned some of the markets that were able to shut down quickly, at least from the initial statistics, and we are here looking at deaths per million of the population locally. You have seen some better performance from the local indicators. Now, of course, again, there's a couple of caveats. First of all, the region was the last to actually see the arrival of the pandemic, and so you would anticipate that it would be behind. But second, you do have some differences in the reporting of these numbers across markets, whether each country is reporting deaths, attributing them to actual COVID-19 deaths, or to a comorbidity that the patient might have had, and therefore skewing some of these numbers. But there is some positive takeaway here. Now, I'm going to get to the economic impacts in a second, how we're forecasting each market coming out of these scenarios. But I did want to highlight how we're thinking about the potential end game. So the end game for us is not just the exit, but obviously the either potential for herd immunity across markets, or the potential for a vaccine that governments in the region are able to acquire and provide effective access to reach herd immunity within the local populations. So this is obviously a very difficult question to answer, as we've seen some accelerated marketing authorization approvals from the FDA and others around some specific treatments, though even the effectiveness of those treatments is still in question about what will be the real impact on the economies. And then we have a significant amount of money going into producing a vaccine. But the biggest question for us isn't necessarily even the timing of having going through the clinical trials and having approval of a vaccine globally, but rather it's the question of how quickly can you even get access in Latin America if you have a vaccine at a global level. Our base case assumption here is that you only have moderate access to vaccine by Q4 of 2021. And I think that this is even being somewhat bullish. If we look at historics, look at all of the uncertainties involved. But even if this were to occur, we have to consider that with moderate access and you're already moving towards herd immunity in the local populations, this could get you close to full herd immunity just between access to the vaccine and actually those individuals that have built up antibodies from being infected and having recovered. Excellent. So that's how we're looking at this from a framework perspective and a scenario perspective. I'd now like to shift into what's going to be the economic impact across each market. And for the purposes of today, I really want to focus on which markets will recover the quickest, at what point do we anticipate that recovery, and then finally, what will be the long-term impact? So how long will it take each market to actually recover the economic output they saw prior to the crisis, following the achievement of herd immunity, either through a vaccine or otherwise? So to answer the first question, what's going to be the timing and magnitude and which market's going to recover the fastest? What we see overall is we're anticipating that within these scenarios that we've laid out, a recovery across markets, or the beginning of a quarter-over-quarter growth in Q3 of 2020. This means that you'll begin to see the recovery in demand in Q3, but it does not necessarily mean that Q3 2020 you'll see the same levels of economic activity as you saw in Q3 2019. In fact, we only expect Latin America to recover to a certain extent to that level by the end of 2021. Now, when we look at a market by market analysis and what markets to prioritize, it will come as no surprise that given the lack of a strong and timely reaction from Brazil and Mexico, as well as the fiscal constraints confronting Mexico, the capacity constraints from an ICU perspective in Brazil's public space, we expect these markets to be the slowest to recover. When you look at Colombia, Argentina, and Chile, as well as Peru, markets that shut down faster, have had relatively more success, with perhaps the exception of Peru, in actually controlling infections and the impact. We see differentiation mostly through a fiscal lens. That means Peru and Chile, where you have much more fiscal space to provide fiscal stimulus, will recover more quickly, specifically Chile, where we've already seen strong fiscal injections. And Colombia, Argentina will recover more slowly. Colombia, obviously better fiscally positioned than Argentina. However, Argentina was already coming out of an economic contraction, which provides it a much lower base in order to show economic acceleration from. Now, getting back to that question mark of when will the markets actually recover to their pre-COVID levels of activity, I already hinted at this, but for the most part, we're looking at the end of 2021. So here we're looking at the index 2019 being 100, and we can see the recovery back to 2021 for the markets Colombia, Argentina, Chile, Peru, earlier in the case of Chile and Peru, which are recovering more quickly, and slower in the case of Brazil and Mexico. Mexico not until really nearly the end of this sexenio, which is going to put, obviously, López Obrador in a very difficult position over the next 24 to 36 months. So overall, what we've seen again is that the policy reactions, as well as the fiscal space available for direct spending, are going to have a dramatic impact on which markets recover the fastest, the timing of that recovery, and the magnitude of that recovery, not only in the short term, but also over the next 12, 24, and 36 months. Now, I want to end this section by also looking at the question mark of FX and the scenarios for these markets. So when we look at the FX question, the key takeaway here, there's really two. First of all, yes, we are anticipating stabilization of currencies by the end of this year. However, even at the end of this year, we will end the year at a lower level than we saw the currencies begin the year. And the second point being is that your markets that are going to be hit the most from a currency perspective are Brazil, Mexico, and Argentina, both in terms of volatility, in terms of average exchange rate, and also in terms of where we anticipate these markets to end the year in terms of their average exchange rate against the US dollar. And then finally, I wanted to highlight here that obviously I've provided the base case around these economic scenarios from the impact. However, we talked about a couple of other scenarios. The scenario around the failed exit that results in a second wave of infections, which is our downside scenario, and our scenario around a governments that fail to adequately pursue this dance coming out of the quarantine, so that are unable to track new infections through their installed base with diagnostics, as well as pursue contact tracing. Now, when we look at these scenarios, this is obviously going to impact the timing of recovery and the magnitude of recovery. From a Latin America perspective, that downside scenario would mean that we would not be recovering full economic activity until well past 2021. And our upside scenario, which is, I already said, all but impossible nearly with the exception of a few markets, Costa Rica being a very particular one due to their ability to control infection rates, would significantly accelerate that recovery. Now, we believe that companies really need to be thinking about these scenarios market by market, because not just from an FX and growth perspective, but this is also going to impact particularly the timing and recovery of out-of-pocket spending, as well as the timing and recovery of elective procedure growth, which we'll talk about in the next section.
Great, thank you very much, Alec. And before we go into the conversation around market access and reimbursement trends in this context, we would like to ask you all a polling question. So if you wouldn't mind just clicking on the answer that best represents your company's position, and we will be able to share the results essentially right away, so you'll get to see how everybody else on the phone is feeling about this. And we have quite a large group with us today, so looking forward to seeing what the distribution is in terms of expectations for top line performance. And meanwhile, if you are wondering about anything that Alec has mentioned, as I said earlier on, you can certainly ask us any questions you would like by reaching out to Dakar Frontier Webinars on the chat function of your GoToMeeting webinar system. I think we'll just be a couple more seconds and we'll be able to see the results. Okay, very interesting. So year to date, actually a good 45% or so have been seeing growth, and then there is a good third of the group that has actually seen challenges in terms of top line performance. Very interesting. So Alec, let's think a little bit about this and how it might play into some of the dynamics across market access and reimbursement that we have seen across LATAM, especially in the context of this very quickly changing situation.
Yeah, no, perfect. So let me go ahead and move forward. Will you let me know if you're still seeing my screen?
We can see a presentation, but it is not in the full presenter mode.
Okay, well, give me 1 second here and we will continue then. Excellent.
Okay.
So I think we're ready to go. In that case, what I'd like to do is talk a little bit about how we will address these questions. So I think that the biggest question mark about the timing of that recovery and the impact on sales moving forward, and also about how you're thinking about the demand planning, engagement, supply chain management, I would highlight one critical question. Now, we all know what's happened in the short term. We've all felt the markets, and we're finally getting information across markets. We entered into this situation. We didn't have data on procedure volumes. We didn't have data on which hospitals were going to close down, how patients were going to react, who is going to provide access to telemedicine. We now have a lot of that information. So the short term, for the most part, better or worse, has been answered. The question is, what comes next in the medium term? And I would highlight one fundamental question that I believe that we need to answer in order to understand that context. And that specifically is, how are governments going to finance or sustain the finances of their private providers in order to guarantee a strong, robust recovery in elective procedures? And now that's going to be important not only for those companies depending on those elective procedures for a lot of the revenue, but also on those companies that are looking at new diagnosis of patients in order to drive demand for their therapies. And if also we're considering the impact on these private providers, a lack or a failure to sustain them financially would dramatically impact the patient journey in most of these markets, as we've seen really across the globe. Now, what's really interesting about Latin America right now is if we're thinking about this question, there's a lot of opportunities to analyze what's happened in your other regions, so Asia Pacific and Europe, to try to predict what's going to happen here. As again, those regions are ahead of the Americas in terms of the infections and the policies that they're going to have to take, and therefore the local debates about how to address the situation are already evolved 1 to 2 steps beyond what we've seen in Latin America, which provides the potential for those insights. So thinking about this question, the private providers, Martina, I think what's most important here is to think about, again, first of all, which of the private providers in Latin America depend on fee for service for a lot of the revenues, which particularly speaking are going to be in Argentina with the private sector that provides services to the social security system, in Brazil, where a lot of the private hospitals and clinics still depend on fee for service payments from the private insurers, and also to a certain extent in Colombia and Mexico. Now, each market has reacted very differently. We now see that, for instance, Chile, the health minister just a few days ago suggested that the market could open back up to elective procedures. Colombia, where we have ICU bed capacity only at 54%, 4% of which is taken up by COVID-19 patients after a significant expansion. Mexico, where in fact the public payer has engaged in new PPP contracts with the private providers in order to use the installed capacity from the private system to pursue elective procedures while the public beds are being used for COVID patients. And then in Brazil and Argentina, which, to be quite frank, we've seen a differentiated approach. Rather than, first of all, injecting money into the private providers, the governments have, I don't want to say made the mistake, but made the decision to inject cash first into the social security payers in the case of Argentina, and into the private providers in the case of Brazil. Now, why that this presents a challenge is effectively because, and what we've seen both in Asia Pacific as well as Europe, is that the phenomena that's occurring is that in many cases, the payers are actually saving money in instances in which you have low infection rates, which in this case would be Argentina, Colombia, Chile, and to a certain extent Peru, even though that's changing at the moment. So that's to say that while the elective procedures are being delayed, they're actually saving money in some instances by what they're not realizing, despite the fact that they have increased cost burden from the COVID-19 patients. So you have a very, let's say, a challenging situation to analyze. Looking across these markets, you have a differentiation between how they've decided to use their private ICU capacity, how they've decided to provide financial injections to their providers and their payers, and then the third, the level of infection rates. Now, I want to highlight why infection rates are so important here. This was analyzing the situation in Mexico in 2009 from the H1N1 crisis, and we see a clear negative correlation between infection rates per state and the number of procedures conducted per state during that year. That's to say that the higher the infection rate, it's very clear the larger and longer will be the negative impact on procedure volumes. So when we first look at that factor, that is infection rates, which again, we come back to the death rates per million because that's more, let's say, a quantifiable factor given the undercounting in many markets. The first thing that we see when we try to answer the question of the impact on private payers and therefore the recovery in elective procedures is that you have many markets in Latin America. I've mentioned Costa Rica as being a very unique case. Argentina, Uruguay, Colombia, and Chile really presenting a significant upside in the short term, where we have Mexico, Brazil, Peru, Dominican Republic, showing, and obviously Ecuador showing a greater weakness. So likely a more sustained impact and a bigger challenge in terms of managing this dance, and therefore recovering the elective procedures in those private facilities, which would suggest that the government should be thinking more short term in terms of how they provide financial assistance to those private payers. Getting to the financing side, what's really interesting here is that really we're seeing each market react differently in terms of how they're going to provide financing. As I already mentioned before, Argentina, which is providing the biggest injections, unfortunately, most of that money is going directly to the social security payers, which is a good thing in the short term because they need that cash as they're being hit very hard from the rising unemployment and the declining revenues. But at the same time, we know that the private providers in Argentina, which provide a lot of the services to the Obras Sociales, the social security payers, were under financial constraints even before this crisis. They've seen their elective procedures plummet, even as Argentina has seen some of the lowest rates of infections and death rates, which if they're not provided with financial aid quickly, is going to put them in a situation that's going to make it very hard to recover elective procedures and pursue CapEx investment over the next 6 months. In the case of Brazil, you see a different situation. Again, the situation is one in which right now most of the new financing has gone to the public payers, public providers, and private providers, where we've seen really a gap in new financing for the private payers. Now, we do see some positive signs on the horizon. BNDES is discussing the Development Bank in Brazil is discussing a particular program to provide cheap credit to those institutions. And ANES, the National Agency for regulating the supplementary health insurance sector, is considering using some of the funds reserved in their reserve fund to inject directly into the private providers. However, neither of those have happened fully at this moment. The rest of these markets, again, I think that the biggest upside is either they have limited exposure in terms of fee-for-service financing against Brazil and Argentina, or you're seeing an acceleration of the PPP model, such as in the case of Mexico. So Martina, yes.
Alec, I was just going to ask you briefly if you could talk a little bit about the way you would group markets across LATAM, across the short and the long term, in terms of CapEx and OpEx spending in private and public hospitals. How would you think about that?
Yes, and that is the critical question today: is how quickly will you see a recovery in OpEx expenditures, or in other words, elective procedures? And how quickly will you see the return in CapEx expenditures on equipment? And how long will that be sustained for? So if I was going to simplify this, because I said there's 3 factors that go into it: the infection rate, the dependence on fee-for-service financing of private providers, and then finally the cash injection to those providers. So if I was going to simplify and put it into 2 groups, I'd say we have 2 groups, and the first one would be contextualized as the group that's going to have a smooth exit. So you're going to see a gradual ramp up of elective procedures. So OpEx expenditure will rebound, but CapEx expenditure, because of the expenditure for COVID, will be delayed. Those markets would include Chile, Colombia, and Peru. My second group of markets would be the markets where you're going to have a bigger delay in the rebound of OpEx expenditure, so looking more towards the middle of Q3, but a stronger rebound in CapEx expenditure, and particularly those would be Brazil and Mexico. Now, you'll notice here, Martina, that I've left out Argentina. Argentina is still a unique case due to the economic situation it was facing before. We see a situation right now in Argentina. It's one of the only markets that you see hospitals actually cutting salaries of their physicians You see some physician groups denying coverage or access for some of the Social Security payers for lack of payment. And it's really opening questions for me of exactly how quickly you're going to see a rebound in elective procedures, but also CapEx investment, which I think is going to really lag both of the other two groups that I mentioned before. Of course,
Yeah.
Sorry,
Alec, we got a question here from the group that I think is relevant to what you were covering. So one individual on the line kind of shared an observation and I guess an implicit question in it as well, saying that it seems like all the hospitals in the region are operating at 30% of their capacity with no elective surgeries, which in the long term will have an impact even for companies for which portfolios are significant for unit intensive care. How would you respond to that? Do you think that how does that get back to some of the trends that you were discussing?
Yeah, so no, it's a perfect observation, and the critical observation here. The question being is, what's the impact on those hospitals' finances? So again, and what we've been trying to contextualize here is that for the public hospitals that rely on a global budget for the year, they could potentially, especially in the markets where you see low infection rates, they're going to be saving money. So the biggest challenge for intensive care is going to be specifically how quickly the demand rebounds and if there are supply constraints, and to the extent to which the governments decide to open access to private facilities to the public sector beneficiaries. For the private hospitals, the key question is how much financial support do the governments provide those hospitals? Because again, if you are in Argentina and you're seeing the physician wages being cut, you're opening up situations which, quite frankly, you're not going to be prepared to attend to demand that when it actually does rebound. So again, I think, and I'm simplifying here, we need to go really, we could spend an hour market by market, but the key question is, to what extent is the financing going to the public hospitals versus the private hospitals, and what's the financial support being provided to each? And again, what we're seeing, and when we did our executive roundtable last week, is that most companies are really having to take this by market basis and look at scenarios on the recovery in terms of demand, market by market, on a quarter by quarter question.
Right, and I think what you're describing also is just the segmentation that needs to take into account these changing factors, perhaps in a way that is refreshing whatever existing segmentation companies had. So
exactly.
Can we talk a little bit about also some of the pre-existing trends, the world before COVID, which seems to be very far away? How is this going to be? How are they going to be affected by everything that you're describing?
Yes. So the pre-existing trends, again, I think that I would highlight here, we divide those into cost-focused, access-focused, and quality-focused. If I'm going to get back to what's most important, I would highlight three, even though for each individual business, I think that the impact will be different. The first one is the delay on the discussion on improving the metrics used by local HTAs. Obviously, not each market is using a health technology assessment organization, but this is going to have huge impacts on access for innovative pharma, particularly because I see a massive delay on these conversations as stakeholders are distracted. And that's going to really challenge the arguments around cost-benefit analysis and how you can continue to accelerate access even within a constrained fiscal situation. The second impact for me would be the growth of full coverage private insurance. We know that for a lot of medtech, Brazil, obviously very important for private insurance. We're anticipating an impact, negative growth of 2 million lives over the next 12 months because of the labor market impact. But it's not just about Brazil. It's also about the private insurance markets that are growing rapidly in key cities in Peru, such as Arequipa and Lima, which will slow dramatically. And it's also talking about a lot of the social security regimes and thinking about the difference between the contributive regimes and the subsidized regimes, and the fact that as unemployment goes up, you're going to have more beneficiaries shifting into the contributive regimes, and therefore having a more constrained access to physical infrastructure, but also in some cases more limited access to what's included in what's being reimbursed. And then finally, Martina, I think with the pre-existing trend that is going to be accelerated and that presents a large opportunity is data interoperability. And why do I highlight this? We're seeing a lot of governments obviously implement digital strategies during this moment, but one thing I think is going overlooked is the fact that governments are having to improve data collection around COVID infections, access to ICU beds, the utilization of ICU beds, personnel utilization, personnel infection rates, all sorts of data, and really bringing those across the public and private markets. I'll give you one key example. Right now, Brazil is discussing creating a fila única, or a single line, for distributing patients between private and public hospitals. That's going to require data integration between those two systems that's never existed before, which could provide a real big turning point for data interoperability, both in terms of the non-clinical as well as clinical data, and open up new opportunities for companies to engage around data aggregation and data analytics moving forward. But Martina, I'd have to say that it's not just about, again, the pre-existing trends. There are going to be new trends that are critical and that are going to impact the recovery of elective procedures, the patient journey, as well as how you're engaging external stakeholders. The biggest new trend that I would highlight here is probably the expansion of public-private partnerships. I already highlighted this before, particularly in Mexico. What's really interesting is López Obrador coming into office was very hard against public-private partnerships. Mexico had around 20 different public-private partnership hospitals being constructed when AMLO came in. Those were frozen. What's very interesting is that just in the last 2 weeks, the IMSS and ISSSTE, the public sector, has re-engaged in these partnerships with private hospitals to provide access to their beneficiaries for elective procedures. And right now, as I mentioned before, we already see a list of about 1,000 patients that have been provided the go-ahead to access those hospitals to get those procedures done in this current moment during the crisis. This is the perfect excuse for AMLO to change his mind and, coming out of this crisis, accelerate the use of PPPs, which would be huge for CapEx investment in Mexico. But it would also be a big impact on the patient journeys and thinking about diagnostics, thinking about getting information, disease information to patients, physicians, et cetera. And then finally, on the public-private partnership side, it's not just about Mexico. We're seeing it in Brazil. We're seeing it in Argentina. We're seeing it really across markets. Then the second key trend that I would highlight here is probably the electronic prescriptions are being expanded, but it's not just electronic prescriptions. Something that's not highlighted here is even the accelerated use of mail order delivery of medicines, as well as really trying to help chronic patients stockpile their prescriptions. And so one of the key examples I'd highlight here, obviously electronic prescriptions expanded in Colombia, permitted in Brazil, but one unique thing that we've seen is in Panama specifically, the Social Security payer, the CSS, decided to contract a private delivery company, one that we would normally use for delivering food, in order to deliver prescription drugs to their patients so they can make sure they could stay at home. That, for me, is a huge turning point to see a small government entity in Latin America deciding to take that action. And I really think could be a big change moving forward in terms of your go-to-market strategy within Latin America. And Martina, I'd just like to conclude here by also saying, within these changing trends, we've also had new stakeholders. These new stakeholders are going to bring new ideas and require differentiated engagement about how we can accelerate or mold these trends. Obviously, I'm not going to go into each of these policy makers individually, but I'd call it a few highlights. Obviously, in Brazil, your new Minister of Health brings a lot of experience in terms of operating private providers. I think that this could potentially accelerate the use of or the cooperation between public and private entities. And then across your other markets, a lot of the new stakeholders bring a more of a public health perspective, which suggests to me that one of the trends that could be accelerated is investment in primary care, training of general practitioners, and overall creating preparedness for a potential second round of infections. And bringing a lesson learned from China is that we're likely to see many of these governments, at least over the next 6 months, invest in preparedness for a second round of infections. And what do I mean by that? I mean that you're likely to see many of these governments increase investment in primary care, increase investment in training of your general practitioners, your nurses, so that if you do go to that downside scenario, which is a large second round of infections, they're prepared. So that said, I'm going to really wrap up this section here. I wanted to share with our listeners also, Martina, that while we've had dramatic impacts in the short term, we really need to prioritize and think market by market about our segments coming out in Q2, Q3, Q4, about elective procedures, but also how the patient journey is going to be changing across markets. There are a lot of opportunities. Policy engagement is going to be key here. I think that it's really going to be a turning point for many of these markets for addressing some of the barriers to access that we've seen in the past. But that's not to say that there's not risk. There's obviously risk in terms of financing, particularly in Argentina, particularly in the private sector in Brazil in the short term. But also, I would highlight that in markets such as Colombia and Mexico, where the public payers were already under financial constraint, I think we really need to be paying attention to potential policy changes around IP protection, as well as how their local sanitary bodies are being invested in, and the decisions that they're making coming out of this crisis to potentially delay access to innovation. So summarizing here, I think, Martina, what we can say is that overall, we will see an acceleration of some of the trends that we saw prior to the crisis, but there are going to be significant disruptions that we need to make sure our entire teams, both from the management perspective, but also those stakeholders that are actually engaging in terms of providing services, key account managers are well aware of, so that we're acting as a team to change our value proposition and ensure that we're addressing each segment in turn to continue to sustain differentiation and make sure that we're prepared for growth in 2021, which I do believe with a good strategy is very, very, let's say, possible to achieve.
So Alec, before we go into the conversation around external stakeholder engagement and also the role that digital tools might play in that, one question I'd like to sneak in, and we'll try and answer some questions at the end as well, is if we go back to the previous page, how would you describe Ecuador's situation compared to some of these markets? Any high-level comments you could make on that?
Yeah, Ecuador's situation compared to these markets. So I classified two buckets for the recovery of elective procedures and other elective activities, and then I put Argentina to the side. Ecuador would have to go in that third bucket with Argentina. First of all, because of their skyrocketing infection and death rates, particularly in Guayaquil. But second of all, because to be very blunt, financing in this market had been deteriorating for the last 18 months, despite certain constitutional obligations for increasing expenditure. And they were already facing a situation where they'd expanded their basic formula, the Cuadro Básico, but they did not have the financing to basically cover what was going to be promised. And this situation, especially considering the fact that Ecuador is dollarized, is going to be very, very, very dramatic in its economic impact on both the key payers as well as the providers. And I think that you're going to see a greater shift to out-of-pocket spending in the short term in Ecuador. So again, there's going to be some opportunities with that shift in the out-of-pocket spending. There's going to be opportunities in how do we support the government through this difficult time. But Ecuador has always been a market of hits and misses, meaning that one year opportunity, next year the opportunity fades. This in the next 12 months, it's definitely going to be a negative outlook, with the need for companies to really be thinking in Ecuador about what comes in 2022 and 2023. So becomes a long-term market very quickly.
Great, thank you very much for answering that. And let's head into our next section.
Excellent. So what I want to do in this next section, thinking about external stakeholder engagement, there's so much we could be talking about right now, from supply chain to external stakeholder engagement to scenario building. From an external stakeholder engagement perspective, really the key question, and I'm going to go directly to the point, I think, is even prior to this crisis, when we were discussing with executives in Latin America, we were already seeing an abrupt shift into digital marketing. So digital engagement with stakeholders, physicians, patients, when and where possible, especially through creating awareness of disease prevalence, treatment pathways, et cetera. But also in terms of even starting to think about engaging public sector decision makers. Now, when we benchmarked this, we were seeing across the globe, the expectation of putting money into digital marketing over the next 3 years was accelerating, moving away from traditional marketing. The challenges were effectively that where you were being successful, so in your biggest markets, Mexico, Brazil, Argentina, Colombia, if you were successful and that was driving your regional revenues, why would you mess with something that was good? So there was a lot of problems with actually convincing internal stakeholders to make this shift, and that was one of the biggest delays. Or what was the factor driving that big delay? The other challenges being faced was where and when you were actually pursuing this engagement. Companies were complaining that either their stakeholders, the physicians specifically, weren't finding the digital marketing content to be differentiated enough. So, it was just they're creating noise amongst the crowd, or those stakeholders are receiving too much information. What's really interesting today is basically 100% of our companies have moved to full digital engagement during this period, both due to necessity, but also in order to manage cost to a certain extent. You're able to pull back some of the sales force, the people on the front line. But you're going to, in that situation, you confront these challenges even more. The differentiation and the information overload, those are just going to skyrocket because suddenly everyone's doing the same thing. So my key takeaways here are, and we're having this discussion with companies across regions, is we need to be thinking about three things. First of all, this situation is not going to last, meaning that stakeholders are going to expect us to go back in person. Your sales reps are going to need to be, you're going to have to go back to a hybrid model, but we're never going to go back to where we were before. This is a perfect moment to pursue three initiatives. The first one being creating multiple A/B testing to understand what's actually making a difference. So where's the ROI? All of your engagement initiatives are digital. So that opens up multiple opportunities for testing across markets, especially your small markets. The second key initiative that companies should be taking right now is, as your internal collaborators are not engaging external stakeholders as much in the past, they have time for training. A lot of the challenges with digital marketing is it needs to be faster, it needs to be more on point. So you need cooperation between services and the market access team, and the medical affairs team, and finance. This is the perfect time to create that training and make sure that everyone's on the same page and understands these initiatives and how to engage digitally with those stakeholders. And then third and finally, content creation. So if you want to drive differentiation, we shouldn't just be thinking about today, but if you have spare capacity within your team, it's an excellent opportunity to reorganize that capacity to be creating content, not just for today, but for tomorrow. And so again, considering this situation, we're not going to go back to where we were before. We're going to be in a situation where every company is going to have to be more in a hybrid model in how they're engaging. And today, the three actions to take are pursue more A/B testing to understand where you're actually driving return on investment. B, make sure that your teams are getting the training necessary when they have the additional time in some cases. And third, make sure you're using that additional time to create differentiated content. That's on the digital marketing front. Martina, I want to leave time for questions. So I want to leave one last message for our listeners today, and that's on the digital solutions front. So how can we create new value for our external stakeholders in this environment? And the key takeaway, we've all talked about it. I mentioned that probably the most publicized change in terms of digital strategy that governments across the world, not just Latin America, but across the world have taken is the expansion of telemedicine. Even in some cases, not just the expansion of telemedicine, but the reimbursement of telemedicine for the first time. So it's one thing to have it legalized, it's another thing to reimburse. So we're pursuing that across markets. We saw we didn't have that before. And across Argentina, Brazil, Chile, Colombia, Peru, we've either expanded it, pursued some sort of reimbursement, or in the case of Chile, we've gone from certain pathologies being able to be treated via telemedicine to expanding the number of pathologies. The key question for me, though, again, isn't necessarily about telemedicine in itself. It's about each company should be considering two factors. A, how are we engaging with stakeholders to make sure that our physicians and our providers are being adequately reimbursed for providing care via telemedicine, so that we end up not feeling additional cost pressures from low reimbursement rates, but also to make sure that those practitioners are willing to engage in telemedicine to provide diagnostic follow-up services and in some cases treatment, and therefore expanding access within our therapeutic areas. That's number one. And number two is what comes next. So we know that it's been about providing access to GPs in this first instance. In Chile, we've started to expand it to provide access to other therapeutic areas and to make sure that our chronically ill patients are continuing their care. But what comes next? Because we've changed expectations. 2021, we're going to have to drive differentiation differently. So what's the next application, market by market? And Martina, I think that this is the challenging message to provide. The answer to this is not going to be one answer for all of Latin America, for all of the globe. Rather, because each market is distinct, each healthcare system is distinct, the answer to this question is going to be unique market by market. But I do believe it's necessary to do that work to answer this question and make sure that we're driving differentiation at the local level. So that's what I wanted to share with our listeners today. I'm going to stop here to see if there's any more questions, Martina, either from you or from any of the listeners that might have submitted a question.
Great, thank you very much, Alec. And I think you've answered a few of those questions in the course of your commentary here on telemedicine. Actually, we got a few questions on the line on that. One question on a different topic that we didn't go deep into, but is relevant here, is about the impact that you expect in terms of supply chain for pharmaceuticals during the dance phase, so to speak, of the containment. We know there have been some challenges in terms of supply chain continuity. What would you summarize as the outlook for the next several months?
So it's an excellent question. And summarizing, I'd say 3 points. First of all, from a logistics point, broadly speaking, one of the biggest pain points has been, and I'm going to stay away from here in the answer in terms of demand planning, because I think we've already talked through that a little bit, even though we can get into more complexity. So the first point would be from a supply of transportation. We know that in Latin America, we rely heavily, obviously, first of all, on cargo flights. We don't anticipate the number and supply of cargo flights to rebound for well beyond the initial recovery phases of the economy, so probably not until the middle of 2021. We've seen that in China specifically, where passenger flights have basically stalled in the recovery and are not even half the levels they were before. So we can expect that there'll be more limited space and your costs will remain high. As well, you're going to need to use more ground transportation, which in this instance is going to increase the cost for ensuring that ground transportation against obviously increased insecurity within the region, given the economic volatility. That's point number one. Point number two is our go-to-market. I only see an expansion of the use of home delivery for a lot of our public payers that we've seen in markets I mentioned before, such as the CSS, the Caja de Seguridad Social in Panama. I think that this is going to be a reaction that a lot of governments take in order to make sure that they're prepared for a potential second wave, because this allows the elderly and the chronically ill to stay at home and not have to go to clinics and hospitals for their prescriptions and to fill the prescriptions and get re-prescribed and open themselves up to being infected. And then third, I would mention that what we're seeing in China, in Asia, and in Europe is that you're already beginning the discussion of local stockpiles of medicines. I don't think that local policymakers have started to think about that as much in Latin America, but I do believe that that discussion is coming. And so I think we're going to have to go away from more of the just-in-time delivery to more of a local potentially local, more stockpiling and helping the governments ensure that their patients are going to have access to particular medicines. And that can even, if you can achieve that, can create differentiation in achieving access and reimbursement market by market.
Great, thank you very much, Alec. I have to acknowledge that we are now at the top of the hour, so any questions that we were not able to answer here and now, we will follow up on through our client relationship director within the next 24 hours or so. For any clients on the line, these materials will also be available to you if you'd like to use them with any colleagues of yours or for further reference. We really appreciate you all joining us today and giving us a few minutes of your time. And we look forward to speaking with you all soon.
Excellent.